Part 1. Doctor had worked for Helix Biologics for 47 years. In that time, she had seen many diseases come and go across the galaxy. Some killed quickly, others killed slowly. All of them made the pharmaceutical companies very rich. This was simply how things worked. The conclave of galactic pharmaceuticals had existed for 3,000 years. 12 major companies controlled all medicine across the known galaxy. They competed with each other, certainly, but they also understood something important. Sick people needed medicine. Medicine cost money. As long as people stayed sick long enough, everyone made a profit. Did not think of herself as a bad person. She had entered medicine because she wanted to help people. Somewhere along the way, she had learned to measure success differently. A treatment that kept patients alive and buying more treatments was better than a cure. A cure meant the patient stopped paying. This logic had seemed reasonable for most of her career. Then the wasting plague arrived and began to question everything. The plague had started on a small colony world near the galactic rim. Within months, it had spread to 17 systems. The symptoms were terrible. Patients developed lesions across their skin. Their organs slowly failed. Death came after weeks of suffering, and nothing seemed to stop it. Helix Biologics had rushed to develop a treatment, led the research team herself. After 8 months of work, they produced a crystalline suspension that patients could inhale twice daily. The treatment harmonized with the body's natural bioelectric field, promoting wellness and supporting the immune response. In clinical observation, about 12% of patients showed improvement compared to those who received no treatment at all. 12% had presented these results to the board with pride. The executives had applauded. By galactic standards, 12% was excellent. Most approved treatments showed single-digit improvements at best. The treatment launched at a price of 4,000 credits per dose. Patients needed 2 doses daily for an average of 6 months. Those who survived often needed ongoing maintenance therapy. The profit projections were extraordinary. Told herself this was helping people. 12% improvement was better than nothing. The company needed profits to fund future research. Everything was working as it should. Then the humans entered the picture. Earth had joined the galactic community just 3 years earlier. Most species paid little attention to them. Humans were small, soft creatures from an unremarkable planet orbiting an ordinary yellow star. Their technology was primitive. Their ships were ugly blocks of metal with none of the elegant curves that civilized species preferred. Their art was loud and confusing. Their food was bizarre. Nobody expected much from them. When the plague reached the human colony on 442b, the conclave had offered assistance. Representatives from all 12 major pharmaceutical companies traveled to the colony to provide humanitarian aid. They brought millions of doses of various treatments. They offered reasonable financing options for the colonists who could not afford full price. The humans had listened politely to the presentations. They had asked many questions about clinical trials and efficacy data. These questions made the pharmaceutical representatives uncomfortable. Eventually, the human colonial governor had thanked everyone for their time and politely declined all offers. The conclave had been confused. Did the humans not understand the danger? Did they not realize they would die without treatment? 6 months later, the human colony reported that the outbreak was under control. They had experienced a 94% recovery rate using something called broad-spectrum antibiotics combined with supportive care protocols. 94%. Read the report 3 times. She checked the translation software. She consulted with colleagues. The numbers did not change. She requested the full medical data from the human colony. The response came within days, which was itself unusual. Galactic pharmaceutical companies guarded their research carefully. Trade secrets were worth billions. Sharing data meant sharing profits. The humans simply sent everything: methodology, patient outcomes, drug compositions, treatment protocols, all of it freely available. Spent the next month studying the information. What she found disturbed her deeply. Human medicine was brutal. There was no other word for it. They did not try to harmonize with the body's natural energies. They did not support wellness through crystalline frequencies. They attacked disease directly, violently, without elegance or subtlety. Their antibiotics were poisons designed to kill bacteria. The drugs worked by disrupting cellular processes, preventing the invaders from reproducing. They simply murdered the disease organisms through chemical warfare. Their cancer treatments were even worse. Humans bombarded tumors with radiation, deliberately destroying cells with targeted energy weapons. They cut open bodies with metal blades, removing diseased tissue by hand. They flooded patients with toxic chemicals that killed rapidly dividing cells, accepting massive side effects as an acceptable cost. It was horrifying. It was primitive. It was everything that civilized medicine had moved beyond thousands of years ago. And it worked. Dear stars, it worked better than anything the galaxy had ever produced. Compiled her findings into a report. She included comparative efficacy data, survival rates, recovery times, and long-term outcomes. The evidence was overwhelming. Human medicine, for all its crudeness, produced results that made galactic treatments look like expensive placebos. She presented the report to the Helix Biologics Executive Board. She expected concern. She expected urgent discussions about licensing agreements and research partnerships. She did not expect laughter. The board members found the entire presentation amusing. Human medicine. Those primitives who had only discovered a few centuries ago. The idea that their crude chemical poisons could outperform of refined galactic medical science was simply ridiculous. One executive suggested that the human data must be fabricated. Another proposed that humans simply had weaker immune systems, making their diseases easier to treat. A third pointed out that even if the treatments worked, no civilized patient would accept such barbaric interventions. Tried to argue. She showed the data again and again. The board members smiled and shook their heads. They thanked her for her dedication but suggested she focus on more productive research. The meeting ended. Returned to her laboratory. She looked at the data on her screens, the numbers that proved everything she had believed was wrong. 12% improvement. She had been proud of 12%. She had watched billions of patients suffer and die, believing that 12% was the best anyone could do. The humans had achieved 94% on their first attempt. 3 years passed. The plague continued to spread. New variants emerged, resisting the treatments that barely worked in the first place. The death toll climbed into the billions. Planets that had been thriving colonies became graveyards. The pharmaceutical companies continued to profit. New treatments launched with great fanfare. Prices increased to cover rising research costs. Patients who could afford the medications lived a little longer. Those who could not afford them died a little faster. Watched it all with growing horror. She knew the answer existed. She had seen the data. Human medicine could save most of these people, but no one would listen. Then something changed. The plague reached prime of one of the galaxy's oldest civilizations. Within months, 20% of the population was infected. The hospitals overflowed. The crematoriums could not keep up with the dead. The government, desperate and dying, did something unprecedented. They reached out to Earth directly. The humans responded immediately. They sent medical teams, equipment, and enough antibiotics to treat millions. They asked for nothing in return except permission to work. The results shocked the galaxy. Recovery rates on Prime matched what the humans had achieved on their colony. Patients who had been given days to live walked out of hospitals weeks later, fully healed. The news spread faster than the plague ever had. Other governments began making their own requests. The pharmaceutical companies tried to intervene, citing regulations and licensing requirements. The governments ignored them. People were dying, and the humans had cures that actually worked. Watched the stock price of Helix Biologics fall by 40% in a single trading day. She watched her colleagues panic, scrambling to discredit the human treatments, to find some explanation that would preserve their comfortable lives. And then she did something she should have done years ago. She resigned from Helix Biologics, packed her few personal belongings, and requested a meeting with Earth's World Health Organization. If the galaxy would not admit the truth, she would force them to see it. Human medicine worked. Everything else was just expensive theater, and was done watching people die for profits. Part 2. The headquarters of Earth's World Health Organization sat in a city called Geneva, in a small country called Switzerland, on a planet that still found surprisingly beautiful. Mountains rose in the distance, their peaks covered in white frozen water that humans called snow. The air smelled clean and strange, filled with scents from plants she could not name. Dr. James met her in a conference room with large windows overlooking a lake. He was tall for a human, with dark skin and gray hair that suggested he was older than most of his species. His office was cluttered with papers and data tablets and small objects that seemed to have personal meaning. Nothing about him suggested the power he held. Had prepared for this meeting for weeks. She had brought evidence. She had rehearsed arguments. She was ready to explain why human medicine deserved to be taken seriously, why the galaxy needed access to these treatments, why the pharmaceutical companies had been wrong for so long. James listened to her opening statement, then raised a hand politely. "Doctor," he said, "you don't need to convince me that human medicine works. I'm more interested in understanding why galactic medicine doesn't." The question caught her off guard. She had expected skepticism, resistance, perhaps condescension. She had not expected genuine curiosity. "I'm not sure I understand the question," she admitted. "Your civilization has been practicing medicine for thousands of years," James said. "You have technology far beyond ours in most areas. Your understanding of biology, genetics, and biochemistry is sophisticated. So why haven't you developed effective treatments?" Thought about this for a long moment. It was a question she had been avoiding for months, perhaps for decades. "We never asked if they worked," she finally said. "We assumed they did." James nodded slowly. "Tell me about your clinical trial process." Explain the standard galactic approach. Researchers developed a treatment based on theoretical principles and traditional knowledge. They tested it on a small group of volunteers, observing whether patients showed improvement. If patients reported feeling better, the treatment was considered successful. It would then be approved for wider use. "What about control groups?" James asked. His translator struggled with the term. "I'm not familiar with this concept." "When you test a treatment, do you compare it to patients who receive no treatment, or who receive a fake treatment they believe is real?" "Why would we give patients fake treatment? That would be deceptive." James smiled slightly. "It would be scientific." Over the next several hours, he explained the principles of evidence-based medicine. He described randomized controlled trials, double-blind studies, and peer review. He talked about something called the placebo effect, where patients often improved simply because they believed they were being treated, regardless of whether the treatment actually did anything. Listened with growing disbelief. The concepts were not complicated. They were, in fact, embarrassingly simple. Give some patients the real treatment. Give other patients a fake. Compare the results. If the real treatment doesn't do better than the fake, it doesn't work. "We have been practicing medicine for 3,000 years, she said slowly. "Are you telling me that most of our treatments are placebos?" "I'm saying you've never tested them properly, so you have no way of knowing," James replied. "Based on your efficacy data, I would guess many of them are barely better than doing nothing at all." This should have been insulting. Instead, felt something like relief. The truth was finally being spoken aloud. "How did humans discover this approach?" she asked. James leaned back in his chair. "We made the same mistakes you did for most of our history. We had treatments based on tradition, on spiritual beliefs, on theories that sounded good but weren't tested. People died from diseases we could have cured if we had bothered to check whether our cures actually worked. What changed? We started asking uncomfortable questions. We demanded evidence instead of authority. We admitted that what we believed might be wrong." He paused. "It took centuries, and it required us to accept that our ancestors had been killing people with their ignorance. That was hard, but it was necessary." The negotiations that followed were unlike anything had experienced in decades of corporate dealings. The humans were not trying to maximize profit or protect trade secrets. They seemed genuinely interested in helping, which was confusing enough. But they also had standards, and those standards proved difficult to meet. Every treatment that Helix Biologics wanted to license required clinical trial data. Real data from properly designed studies with control groups and statistical analysis. When admitted that such data did not exist, the humans were not angry. They were simply puzzled. "You've been selling this treatment for 800 years, James said during one session, reviewing files on a cardiovascular medication. "And you've never tested whether it actually helps heart disease patients." "We have testimonials from millions of satisfied users," offered. "That's not evidence, that's marketing." The distinction took her several days to fully understand. Testimonials meant patients had reported feeling better. Evidence meant patients had actually gotten better, measured objectively, compared to patients who received no treatment. The difference seemed subtle but was actually enormous. News of the negotiations spread through the galactic pharmaceutical industry. Helix Biologics was not the only company seeking human licenses. All 12 major corporations had sent representatives to Earth, each hoping to gain access to treatments that actually worked. The humans treated them all the same way. "Show us your evidence. Prove your treatments work. Meet our standards and we will help you bring medicine to your populations." Most of the corporations could not meet these standards. Their treatments, tested properly for the first time, showed results barely better than placebo. Drugs that had been sold for centuries, generating trillions in profits, turned out to be expensive nothing. The reaction across the galaxy was intense. Some governments demanded investigations. Others defended the pharmaceutical companies, insisting that traditional medicine should not be judged by alien standards. Protests erupted on dozens of worlds, with patients and families angry about the deaths that could have been prevented. Watched the chaos from Earth, far from the turmoil but deeply affected by it. She had spent her career in an industry built on comfortable lies. Now those lies were being exposed, and people were looking for someone to blame. She could have returned to defend her former employers. She could have argued that they had acted in good faith, that they had not known their treatments were ineffective. In some ways, this was even true. The system had been broken for so long that no one had noticed. Instead, she chose to stay on Earth and learn. The humans welcomed her. They gave her access to their medical schools, their research facilities, their historical archives. She studied how they had transformed their own medicine from superstition into science. It had not been easy. It had not been quick, but they had done it, and the results spoke for themselves. Human children rarely died from infections that had once killed millions. Human adults survived cancers that would have been death sentences a century earlier. Human elderly lived longer, healthier lives than any previous generation. All because they had learned to ask a simple question: does this actually work? After 6 months of study, applied for a position with the World Health Organization. They were building a new division, focused on helping galactic species reform their medical systems. They needed people who understood both human methods and galactic culture. James reviewed her application personally. "You understand this will make you unpopular at home," he said. "You'll be seen as a traitor by many." "I have watched billions of people die from treatable diseases," replied. "I have sold them medications that did nothing while promising them hope. If helping change that makes me a traitor, then I will wear that title with pride." James nodded slowly. "Welcome to the team, Doctor." Part 3. 5 years after first contact, stood in an auditorium on Prime, looking out at 2,000 students from 47 different species. They had come from across the galaxy to study at the new Institute for Evidence-Based Medicine, the first school of its kind outside Earth's solar system. The building had been constructed on the site of a mass grave, where millions of plague victims had been buried during the worst of the outbreak. This was deliberate. Every student who entered these halls walked past monuments to the dead, reminded constantly of why their work mattered. Had opposed this location at first. It seemed morbid, even cruel, but Doctor had insisted. "Medicine is not abstract," he had told her. "Every failure has a face, a name, a family left behind. If your students forget that, they will make the same mistakes we did." She understood now. The monuments were not meant to create guilt. They were meant to create responsibility. The students in the auditorium came from species that had been practicing medicine for thousands of years. Many of them had graduated from prestigious schools on there. They had arrived believing they knew how to heal the sick. Their first semester had been humbling. They had learned that most of what they knew was wrong. Their traditional treatments had been tested against placebos, and most had failed. The drugs they had prescribed for decades showed no benefit over doing nothing at all. Some students had resisted this information. They had accused the humans of arrogance, of cultural imperialism, of trying to replace ancient wisdom with foreign methods. A few had even withdrawn from the program, returning home to defend practices that their own data proved were useless. Most had stayed. They had looked at the evidence, examined their own assumptions, and accepted the uncomfortable truth. Their medical traditions were failures. Human medicine worked. If they wanted to help their patients, they would have to learn new ways. Today's lecture was about the philosophy underlying evidence-based practice. Had delivered this lecture dozens of times now, but it never became routine. "The humans have a saying," she began. "The first step toward wisdom is admitting what you don't know." She paused, letting the words settle over the audience. For most of galactic history, medicine was practiced as an art rather than a science. Healers learned techniques from their teachers, who had learned from their teachers, going back generations. They believed in these techniques because they had always been believed. They never tested them because testing would imply doubt, and doubt was considered disrespectful to tradition. A student in the front row nodded slightly. His entire family had been killed by the plague, treated by methods that a simple controlled trial would have revealed as worthless. The humans took a different path. They decided that belief was not enough. They decided that tradition was not proof. They decided that the only way to know if a treatment worked was to test it rigorously, honestly, and without preconceptions. She brought up a series of images on the screen behind her, charts showing mortality rates over time, graphs comparing outcomes between galactic and human treatment protocols, numbers that told a story no words could capture. In the 5 years since we began implementing evidence-based practices, plague mortality has decreased by 89% across participating systems. Cancer survival rates have increased by 340%. Average is increasing in every population that has adopted human protocols. The numbers were abstract, but behind each one were living beings who had been saved. Children who would grow up with parents, elders who would see their born, workers who would return to their families instead of being carried home in memorial containers. These results were not achieved through advanced technology or superior resources. Many human treatments are simpler and cheaper than the traditional alternatives. What made the difference was honesty, the willingness to admit that what we believed might be wrong, and to change our practices based on evidence. A hand rose in the middle of the auditorium, nodded toward the student, a young with iridescent scales. "Professor, how do we convince people to accept treatments that seem so different from what they know? On my, patients often refuse human protocols because they find them frightening or undignified." It was a good question, one that came up in every class. "Medicine is not just about science," replied. "It is also about trust. Patients need to believe that their healers have their best interests at heart. When we tell them that everything they knew was wrong, we shake that trust." She stepped away from the podium, moving closer to the students. "The answer is not to force change, but to demonstrate it. When patients see their neighbors recovering from diseases that once killed everyone, they become curious. When they meet survivors who would have died under traditional treatment, they start asking questions. Change comes slowly, but it comes." After the lecture, found James waiting in the corridor. He had traveled to Prime for the Institute's annual review, checking their progress toward full WHO accreditation. His hair was completely gray now, and he moved more slowly than when they had first met, but his eyes remained sharp and curious. "Good lecture," he said. "You've come a long way from the corporate researcher who first walked into my office." "I had good teachers," she replied. They walked together through the Institute's gardens, past the memorial walls with their endless lists of names. Students hurried between buildings, carrying tablets and arguing about research methodologies. In a nearby laboratory, a team was testing a promising new treatment for a blood disease that had plagued the species for centuries. "I've been reviewing your outcomes data," James said. "You're producing graduates who match Earth standards. Some of them are even pushing beyond what we've achieved." "They have motivation we never had," said. "They watched their worlds die from treatable diseases. That kind of experience focuses the mind." James nodded slowly. "There's something I've been meaning to ask you. In all the years we've worked together, I've never asked if you regret your previous career. All those years at Helix Biologics." Considered the question. It was one she had asked herself many times. "I regret the deaths I could have prevented if I had questioned sooner," she said. "I regret the patients I treated with medicines that did nothing. I regret the time I spent defending a system I should have been fighting against." She paused, looking up at the pale blue sky of Prime. "But I do not regret the path that brought me here. Every mistake I made taught me something. Every failure showed me what needed to change. If I had been wiser earlier, I might not have been in a position to help when the moment came." "That's a generous way of looking at it." "It is the only way I can live with myself." They continued walking in comfortable silence. Near the edge of the gardens, a group of human medical students had gathered with their galactic counterparts. They were comparing notes, sharing techniques, arguing about the best approaches to difficult cases. The humans did not seem arrogant or superior. They seemed like colleagues, equals, fellow seekers of truth. "You know," James said eventually, "when we first made contact with the galaxy, we expected to be the ones learning. Your species have been traveling the stars for. We assumed you would have medical knowledge far beyond ours. And instead, you found that we had spent perfecting the art of doing nothing effectively." James laughed softly. "I wouldn't put it quite that harshly." "I would. It is the truth, and truth is what we deal in now." A young human student approached them, a woman with red hair and freckled skin. She was carrying a data tablet with a research proposal on it, seeking feedback from any professor willing to help. Recognized the proposal. It was a plan to test a traditional treatment for respiratory infections, using proper controlled trial methodology. The treatment was one she had helped develop decades ago at Helix Biologics. She had always believed it was effective. Now it would finally be tested honestly. "Do you think it will work?" James asked after the student had left. "I hope so," said, "but hope is not evidence. We will test it and we will accept whatever the data shows." That's the spirit. As the sun set over Prime, painting the sky in shades of orange and purple, thought about how much had changed in just 5 years. The old pharmaceutical companies were shadows of their former selves. Their profits evaporated along with their credibility. New organizations were rising to take their place, built on principles that would have seemed radical a decade ago. Transparency, rigor, evidence, the simple idea that treatment should actually work. Humanity's greatest gift to the galaxy had not been their medicines, though those had saved billions of lives. It had not been their technology, which was already being surpassed by galactic researchers who applied human methods to ancient problems. The gift was a question, a simple, powerful, revolutionary question that every healer should ask about every treatment they provided. Does this actually work? Across the galaxy, for the first time in thousands of years, the answer was finally starting to matter.